Hey everyone, Dan from FiftyOne here, and I'm excited to bring to you today how visual AI is transforming the healthcare space. We'll be showing you how 51 Teams is overcoming some of the key challenges in the space today, some of the highlights of how visual AI is impacting healthcare across the board, and actually spend some time on some real life use cases at the end to show you how 51 Teams can empower your ML engineers to do better work. Voxel 51's vision is clear. It's to bring transparency and clarity to the world's data. The number one thing slowing down ML projects today is just poor quality data. Engineers are spending way too much time trying to get to the perfect data set, only for their models to trip up over mistakes or just poor quality data in general. That's why we see more and more ML engineers moving towards a data-centric thinking, away from models, that if the core property that's going to drive their ML teams to have success is by having high quality data sets. New models will keep on coming out to replace the old ones, but having a strong and rich data set that you can always train on is what's going to prove to give you the most success in the future. 51 Teams is helping you do this today in the healthcare space by helping you organize millions of samples in any format that you want to do. You can bring this data in, put it all into one place so that you have one central location to be your single source of truth. You can even find and eliminate false positives and make sure that your data is of the highest quality. By curating better data sets, you'll be able to train your models to better performance. We also can help with other workflows, such as the de-identification of patient data to make sure that privacy is maintained throughout your entire ML workflow. All this is backed by dataset versioning, so if anything goes wrong, you're always able to roll back your datasets to a previous version and continue doing your ML work. No more pains of worrying about an intern blowing up your dataset, an augmentation that didn't go the way you expect, or maybe something else that just drastically impacted the overall efficiency of your dataset. With dataset versioning, we can always roll back and make sure that our peace of mind is always intact. Some of the key industry challenges that we're seeing in the healthcare space today, first one being the rising costs. We know in America, rings true for many people, that we can actually see that 43% of Americans know a family member that has put off healthcare due to the rising costs. Also, we see that there's a doctor shortage across the world, where if we really were to address all the concerns of healthcare across the globe, we would need at least 12.8 million more doctors. And all these doctors are just spending a ton of time per patient just scanning over their records, whether it's looking through CAT scans, X-rays, or just retrieving these scans. Doctors are spending more than 16 minutes per patient just looking over their records. However, visual AI is coming in today to impact the healthcare space, bringing in new efficiencies across the board, whether it's computer-aided detection and diagnoses, monitoring the disease progression, helping through surgeries, or more. And we'll dive deep into a couple of these ones to show you exactly how AI is affecting healthcare. For instance, aided detection and diagnosis is not new to the computer vision space and has been around for a very long time. Computer vision models are supplementing doctors' diagnoses by detecting things like cancer, tumors, or other rare diseases in CAT scans, pictures, as well as X-rays. We also see that AI can help monitor the disease progression. Over long periods of time, and sometimes hundreds of scans, we can actually track the progression of diseases like cancer, Parkinson's, or glaucoma. That way, doctors are empowered with insights that they wouldn't get otherwise without using these AI models. Another use case that we're seeing more and more today in computer vision is interoperable surgical guidance. This is enhancing the precision of doctors today by using real-time visual and spatial information to know exactly what is going on during the surgery and make sure that their patient is intact all times. We can also automate over 80% of complex surgeries today using some of the state-of-the-art robotics. Things like sewing someone up, cutting them open, or even doing potential surgical operations on organs. It's all possible using computer vision and robotics today. We're going to be going through two main use cases here with Voxel 51 Teams, where we can see how real ML engineers are taking in these scans and applying visual AI to get the most insights for their doctors. We're looking at two examples. The first one we'll be looking at is segmenting CAT scans, where we can see a CAT scan of multiple different types being inferenced on by NVIDIA's new Vista 3D model to find over 100 different organs or potential tumors inside their patients. We'll take another look at a chest X-ray data set, which is classifying different diagnoses, doing object detection on tumors and other related diseases on over 100,000 different X-rays. So without further ado, let's dive into both these use cases and see how 51 teams can empower these workflows today. Let's start by taking a look at the total segmenter 50 dataset. This is a dataset that features multiple different types of CAT scans coming from different machine models that has annotations on top of it from the Vista 3D NVIDIA 3D segmentation model. In this dataset, we can view any of the CAT scans by hovering over the sample on the grid and watching the CAT scan flow through the human body. We can click in onto any of these samples to understand more of what's happening. As well as you can see what's happening here, we can store labels on any of the frames within the video. I can pause the video at any point to hover over any of the highlighted portions to understand exactly what it is, to find things like the upper lung, the gluteus minimus, or other organs inside of the body. You can sort, filter, and slice your dataset for any of these CAT scans on many different things, such as the gender of the person of the CAT scan, age of the patient, as well as the pathology. So if we're interested in only finding specific CAT scans, for instance, CAT scans featuring tumors, we're going to be able to find these very easily using 51 and identify them inside the CAT scan using our segmentation model. This has helped you organize your data in a much more intuitive way, as well as helping you give understanding to both ML engineers as well as potential doctors to help better understand their CAT scans. We can see multiple different locations of pathologies, different types of inflammation, all possible to be scanned, filtered, and sliced on to find exactly what you're looking for. Interested in only throat inflammation or throat tumors? Find exactly what you're looking for by using Voxel 51's slicing, filtering, all available on the slide bar. Whatever metadata you have on your dataset, you're able to store it as much as you possibly could like. For instance, we can see all the different metadata that I've stored on this dataset, such as the pathology, even things like the scanner model, any more, all possible within 51. Once your data's in, there's many things that you can do with it. You can do things like apply new models on top of your dataset, as well as compute embeddings if that's what's interesting to you. You can pass in a brain key, such as CAT scans, select the model you're interested in, and then store your embeddings for visualization. All this is possible built into Voxel 51's tools, where you can build in your own custom workflows as well, load in data like CAT scans, DICOM, and more, all with Voxel 51's tools to get the insights that you need both into your machine learning models as well as your medical practices. The next dataset we'll be taking a look at is the ChestX Ray 14 dataset. This dataset features over 112,000 different X-ray scans, all with according to the findings, whether there is something that was found or no findings, as well as potential detections if there is something being found. In these cases, we can scroll through our grid here to understand exactly what our dataset is, whether someone is found with a nodule, an infiltration, or a hernia. It's all possible with the grid to scan through and understand your data set. Looking for a very specific disease? No problem. Head over to the Findings tab, and you can filter all the ones that you're interested in, such as infiltration, mass, and let's say pneumonia. Through this, we can find exactly what we're looking for in our data set, find exactly the samples you want to train on if you're going to train a specific model on only a subset of your data set. With 51, it's very easy to find these subsets of the data set that you're looking for, and then export the code exactly so that way you can then train your models on top of this data set. Export your data with code, a cloud export, or a direct download is all possible with Teams. Once you have the data that you want to train on, train your models, and you can actually bring these findings back in, as well as other types of models that you potentially want to train as well. Once we have our findings back on, clearing our filters, we can head over to our detections to find even more fine-grained information, such as exactly where our pneumonia is located in our dataset. We can scroll through our dataset to find exactly all the different samples that have pneumonia detections on them, to understand how these size up, the differences of them, and all the different information we might be concerned about. Use this for both machine learning models as well as empowering your doctors and patients to understand more about the data and scans that they're given. If you want to find more out about your dataset, you can even do things like computing the similarity of your dataset. to understand exactly which is the most similar samples in your data set. And this can be done over your entire data set or the current view, like our pneumonia view that we're looking at right now. All this is possible with Box 51, where you can then export your data sets, import the new data set as it comes in. So if you have new scans come in, we can upload those and annotate them as the data comes in. Want to roll back your data because the new data that came in is no longer good? We can go over to our history tab and roll back to our first upload, or even make a new snapshot on the fly to make sure our data is always maintained how we want it. Add an optional description here, such as a new snapshot for July. And we can save this new snapshot anytime. We can then always roll back to it, see when it was created, who it was created by, and the number of samples inside of it. You'll also be notified whenever the snapshot was successfully created. You can also head over to our Manage tab to find basic info of our dataset, the access of the dataset to add, remove, or grant new access to new users, as well as share your dataset with a link. That way anyone can view the exact thing that you're looking at. This allows contributors to add new data, new labels, as well as new models, but also empowers guest roles to understand exactly how the model is progressing through the flow. We understand here at Boxes 51 that there are many stakeholders on your dataset, so it's important to give these stakeholders full view of your dataset without having to get into the nitty-gritty, such as training models or adding your own augmentations. Voxel 51 teams make it very easy for you to share your datasets across your organization without having to worry about any security concerns or anyone messing up your dataset. With 51 teams, you have full control over who is seeing your data and what they can do with it. To close out, if you want to check out these datasets for yourself, head over to our try.51 AI website, where you can find the Segmentator 50 or the Chest X-ray 14 datasets, full for you to view and explore the same way I just showed you. Be sure to check out all the datasets we have at try.51, including multiple different other industries, as well as guided walkthroughs that will show you some key workflows that you can perform in 51 Teams to level up your ML teams like you've never done before. I hope you enjoyed this presentation, and I look forward to giving you the next one.